Yes, busy afternoon. Good afternoon, everyone. Again, our apologies for starting with a little delayed start time. We are the Senate Budget and Taxations Committee's a subcommittee on Health and Human Services. Today is Friday, February 25th, 2022. We have one budget before us this afternoon, that is DHS Social Services. So we're going to turn it over to our budget analyst, Samuel Quist. Good afternoon, sir.
Good afternoon. All right, we have the presentation pulled up on the screen in front of you all. Once again, this is the budget for the Department of Human Services Social Services Administration. The fiscal 2023 allowance is $653.3 million. This is an increase of $15.3 million, and the increase is mainly in the foster care maintenance payments program. I'm going to start the presentation by turning to the performance analysis section of the document. The chart Exhibit 1 in front of you, this is showing the number of child maltreatment reports per month, which has been impacted by the pandemic. As you can see, in about February to April of the year 2020, in the initial months of the pandemic, there was a decline by about 60%. This corresponded to the closures of in-person schooling, childcare, medical visits, and other reduced opportunities for in-person contact between mandated reporters of child abuse and children. And it's since still remained lower than the pre-pandemic levels. The data in this report goes until August of 2021. There was a slight increase between April of 2020 and March of 2021. However, the final months on the chart through August of 2021, there's a decline, and the mark in August was lower than the previous pandemic low in August of 2020. However, I would note there is some cyclical nature to these reportings, and in the summer months when school is out of session in prior years, there was some fluctuation up and down with that. I would also note that DHS has recently made additional data on this available through the fall of 2021. However, due to the timing, it's not reflected in this report. Preliminarily looking at this data, there is some indication that reporting is trending back upwards. However, at this time, it's still too early for DLS to determine the full impacts of the current school year. There is data to suggest that the nationwide trends impacting the from the COVID-19 pandemic impacting the child welfare system nationwide are similar to what's been occurring to Maryland in this respect. The analysis cites a report put out by the U.S. Government Accountability Office earlier this year, in which the U.S. Department of Health and Human Services surveyed officials at state and local child welfare agencies in 5 states across the U.S. And these states, they reported seeing similar declines in child maltreatment reporting in the initial months of the pandemic. And they found that they were for similar reasons as had been occurring in Maryland. However, this report showed that unlike in Maryland, in the fall of 2020, the trends began to return to pre-pandemic levels, and in some states, depending on the level of in-person schooling and other in-person activities, actually returned to pre-pandemic levels at that time. In some other states, there were also concerns related that child abuse was going unreported and that certain cases were not being reported until they had escalated to a higher level. DLS is asking DHS to comment on any potential causes behind the slow return to pre-pandemic levels in child maltreatment reporting, and if they have any observations regarding the severity of cases being reported, or if there is concern that there are cases going unreported. Exhibit number 2 is showing trends in the reporting of adult abuse. There was declines in adult abuse through Adult Protective Services, through SSA's programming for vulnerable adults in the year fiscal 2020 related to the pandemic and impacts from that on in-person contact between vulnerable adults and others. However, this chart is showing that in 2021, the rate of reporting is again increasing. However, the green line on this chart, which is showing the indicated or confirmed cases, declined in fiscal 2021 to the lowest point within the 5 years shown in this chart. I'm going to skip ahead to Exhibit 4. This is showing two things: the rate of removals into foster care as well as the rate of placement moves. The rate of removals has declined and has been trending downward in recent years due to the focus on the department on implementing evidence-based prevention services under the Family First Prevention Services Act, and the goal is to provide additional support to families to prevent the need, when able to do so, to prevent children from entering into care if they can be maintained safely in their home. And I'll discuss this issue a little bit later in the presentation. The other item, the red line in this chart, is showing the rate of placement moves for children in foster care. This had increased in fiscal 20 and 21, and the department has indicated that there is some impacts on the COVID-19 pandemic, specifically related to quarantine-related issues on placement stability. Turning to the budget discussion section, the next page of the analysis is discussing the federal stimulus funding. Starting in fiscal 2021, there was a total of $14 million in federal stimulus funding received by the Social Services Administration. The majority, about $11.8 million of this funding, was supplemental funding for the foster care maintenance program. This was funding through both the CARES Act and the Coronavirus Response and Relief Supplemental Appropriations Act later on in 2020. And there was also additional funding for both child welfare services and adult services for responding to impacts of the pandemic. In fiscal 2022, it is anticipated that there will be about $9.7 million in fiscal federal stimulus funding received. This is primarily allocated through deficiency appropriations in the budget bill. And it's for similar purposes. $4.2 million of this is for foster care maintenance payments program to support family stabilization and services for older youth in care. And there's also supplemental funding for both child welfare services and elder abuse prevention programming for adult services. Exhibit 5 is showing the overview of fiscal 2023 spending in the allowance. Almost exactly half of the budget, about $326 million, is for the foster care maintenance payments program. The other half of the budget, within that, the majority is for personnel expenses, about $231 million, and the largest area is in child welfare services. Exhibit 6, which shows the main changes in the budget. While the most largest changes occur within the foster care maintenance program, I would just briefly note a couple of other changes outside of that program. Within the personnel section, there is a $3.1 million increase in costs for employee and retiree health insurance premiums. There's a decrease of about $1.1 million related to regular earnings due to the net abolishment of 2.7 regular positions. Within the foster care maintenance payments, if we scroll down a little bit here to fit this all on the screen, the total increase within this program is $18 million. The majority of that is within general funds. And the largest item on the top of this chart is $10 million, which is budgeted for provider rate increases in fiscal '23 for foster care providers who have rates set by the Interagency Rates Commission, or the IRC. The other large increase is $7.3 million in flexible spending funds. These are funds that are used for a variety of foster care services, and they are increasing to better align with most recent actual spending in this category. The third line down on this chart that I'm going to highlight is $5.3 million. That's the net increase in placement costs for all other types of foster care placements outside of the regular foster care home placements. This is taking into account both the fiscal '22 provider rate increases and is also increasing due to better align with most recent expenditures in these categories. Some of these categories, specifically the institutional placement categories, have been increasing in the past year. Despite the fact that the caseloads have been declining, there's still been increasing. The institutional category, for example, increases by over $10 million, and that remains the most expensive placement type for foster care. There's also a line item in here that's an increase of $1.1 million for hospital overstay costs. These are budgeted as a separate subprogram for the first time in fiscal 2023. This is in relation to concerns raised by the General Assembly in prior sessions that these funds for this purpose be budgeted separately. And the main declines in spending at the bottom of this chart, well, first in the foster care maintenance payments, there's $4.2 million and $5 million. These are the two deficiency appropriations for supplemental funding for foster care maintenance payments and the 2022 provider rate supplements. And at the bottom of the full chart is the two supplemental federal stimulus funds for child welfare services and adult protective services in fiscal 2022. Exhibit 7, this is showing the caseload data per year. These are the average monthly caseload numbers by placement type for the foster care placements. As previously discussed, relating to the child maltreatment reporting, as a result, the foster care caseloads have been declining due to lower entries into care. After declining by about 4% in fiscal 2020, you can see on this chart there was a rather notable decline between 20 and 21. In 21, the total decline was about 15.5%, and the declines occurred within all placement types. Year to date, fiscal 2022, this data is through December, so we have the 6 months, the first half of the fiscal year. The caseloads are declining in total by an additional 6.5%. This is due to the lingering impacts of the COVID-19 pandemic, although there has been some slowing in declines for some of the placement types. Exhibit 8 is showing similar data for subsidized adoptions and guardianships. These placements were also impacted by the pandemic due to closures in the courts and reductions to court operations earlier on in the pandemic. However, as you can kind of tell on this chart, there has been less of an impact related to the foster care placements. This is due to the fact that once the court activity resumed at the end of 2020 and into 2021, there was a faster resumption of children moving into placement in these two areas. Percentage-wise, the adoptions are decreasing by 3.9% in 2021 and 2.5% in 2022 year-to-date. Subsidized guardianships decreased by 4.6% in 21 and a little under 1% in 2022. Exhibit 9 is showing a comparison of the average monthly caseloads used in the budget assumption compared to the average monthly caseloads that the Department of Legislative Services has projected in our own budget assumption. As you can see in fiscal 2022, the DLS estimate is lower than the budget estimate. The reason for this is that the DLS estimate is revised based on the current available actual data available through December, whereas the budget estimate is data that was available at the time of the budget development last year. And at the time of the budget development last year, there was anticipation that there would not still be as significant of impacts from the pandemic at this point. However, that's not turned out to be the case, so DLS has subsequently revised its caseload estimates lower, and we're now anticipating that the rebounding in caseloads will not occur until later on, most likely in fiscal 23. However, in fiscal 23, the estimates between DLS and the budget for caseload levels are fairly similar. I think there's agreement between both DLS and the budget that we're assuming that hopefully once we get to fiscal 23, there will be less impacts of the pandemic impacting this area. I'd like to talk briefly about the provider increases. As mentioned previously, there's $10 million budgeted in the allowance in 23 for provider rate increases for foster care providers who have rates set by the Interagency Rates Commission. I would note that fiscal 23 is kind of a unique year due to the fact that there was not a budget reconciliation bill this year. In previous recent fiscal years, budget reconciliation language limited the percent increase on provider rates. In fiscal 2022, it was about a 4% limit. However, in fiscal 23, there is not a percent limit, so there is not currently a percent increase until the IRC has met later in the year and determined what the rate increases will be. For the simple purpose of forecasting, DLS is using a 4% provider rate increase. However, we are noting that due to the uncapped nature of rate increases, the actual rate increases in fiscal 23 could be more substantial in size than that. Turning to the next page, Exhibit 10, this chart is showing the average monthly placement cost increases for the 5 foster care types that have seen the largest increase in costs for average monthly placements between the 2022 budget and the 2023 budget. These include both emergency and treatment foster care, purchased homes, purchased institutions, as well as treatment foster care for minor mothers and infants. As I mentioned earlier, despite the fact that there's been declines in caseloads for some of these types, the average monthly placement costs have been increasing, most notably the largest purchased institutions during the past year, and the fiscal 23 budget is aligning the costs in the budget to some of the more recent actual expenditures. Exhibit 11 is the forecast conducted by DLS on the foster care maintenance payments program. DLS is projecting a surplus in this program in both fiscal 22 and 2023. The surplus in 2022 is $6.4 million, and in 23 is $8.7 million. DLS is forecasting that the largest share of that will be in general funds both years. The 2022 surplus is forecasted due to the lower numbers of the actual caseloads that are occurring compared to what the budget was initially based on, as previously discussed. And the fiscal 23 surplus is a preliminary estimate, and we would note that it may ultimately be impacted by the actual size of the provider rate increases, what the increases in size of caseloads are, as well as the availability of Title IV-E federal funding. So the 23 estimate is more of a forecast at this point, and due to the uncertainties that may occur in the coming fiscal year, DLS is not making any recommendations this year to reduce funding based on these surpluses. However, DLS is recommending the annual budget bill language that restricts general funds in this program to those purposes only, which, if there was a surplus at the end of the year, that language would allow the savings to revert to the general fund in that scenario. The personnel data section in the next page, as mentioned previously, there's a net decrease of 2.77 regular positions. This is taking into account both positions abolished as well as interagency transfers between departments. I'd also note the vacancy rate. There are currently a total of 342 vacant positions within the Social Services Administration, which is about 158 greater than necessary to meet the turnover expectancy. This level of vacancies is approximately 13% of the total agency positions. By program, the majority, about 287, occur in the Child Welfare Services program. And DLS notes that this current vacancy level is an increase of over 100 additional vacant positions from the same time 1 year ago. And we'll talk a little bit more about positions when we get to the caseload staffing issue later on in the analysis. But first, I'm going to turn to the first issue in the analysis is related to hospital stays for out-of-home placements. And the chart I'd like to highlight is exhibit number 14, which is showing the stays for hospital stays longer than medical necessity for medical and psychiatric patients. And this is showing that there's been data requested through budget bill language on hospital stays for youth in out-of-home placements for several years now. And the data is showing that the hospital overstay issue is continuing to occur. And in Exhibit 14, based on data provided by the department, in calendar 2020, there were 11 youth in medical hospitalizations which experienced overstay days, totaling 312 days, and 73 youth in psychiatric hospitalizations experiencing overstay days, totaling about 2,865. In calendar 2021, this is only through September of that year, there's a little bit of a decrease, 12 youth in medical hospitalizations experiencing overstays of 171 days, and 74 youth in psychiatric hospitalizations experiencing overstays of 1,250 days. The JCR report also included statistics on placement types after discharge from youth that were in inpatient hospitalizations. This is not just the overstay patients, but all of the patients having an inpatient hospitalization. The majority of discharge, there were 436 youth in total in this chart. The majority went on to be placed in residential treatment centers, and there was a total of 6 that were placed in out-of-state providers. The analysis also highlights, I scroll down here, the Governor's Office of Crime Prevention, Youth and Victim Services issues an annual mandated report to the state of Maryland on out-of-home placements. And this report was discussing further about the overstay issue and actions that could be taken to address that. The report stated that there were a total of 629 placements across all of the child placing agencies in Maryland. That's not just DHS, but also includes the Department of Juvenile Services, certain areas within MDH. There were 609 total out-of-home placements across these agencies that were had an inpatient hospital stay during fiscal 2021. The report notes that this was a 23.4% decrease compared to fiscal 2020. However, the assumption that this is more of a reflection of the lower overall caseloads rather than a reflection of less need for these placements. And one of the key findings that this report found is that providers and both placement agencies alike agree that there needs to be additional specialized residential treatment programming in the state in order to reduce the number of wait times between the referral and the placement for these services. And this will also address the overstay issue. In response to this, briefly mention MDH had awarded a $5 million grant to residential providers, specifically targeting programming for youth at risk of an overstay. The Department of Human Services also has issued a statement of need in order to procure additional high-level services in this area in order to address the overstay issue as well as to defer youth from needing to be served in a residential treatment center. The other issue tying into this, the second issue, is implementation of the Family First Prevention Services Act. As I mentioned previously, the department in recent years has focused on implementing evidence-based practices for prevention services, the overarching goal being to reduce the need for removal into care if there can be services provided safely to children and families in their homes. And in some cases, this will tie into the previous issue with reducing the need for higher level services. Exhibit 16 on the screen is showing 5 of these evidence-based practices that the local departments of social services are implementing, as well as the number of families served in 21 and 22. There were also 3 additional prevention services that were included in the state Title IV-E plan that was submitted by DHS. Those 3 were not rated by the Title IV-E National Clearinghouse at the time that the program was submitted. However, subsequently 2 out of 3 of those have also been rated by the clearinghouse as a level that would meet the criteria for federal reimbursement. There was a JCR report that the department had submitted on this topic also, which provided some additional discussion on this implementation and had indicated that in fiscal 22, the department is continuing its work on implementing this array of prevention services. Exhibit 16 is showing the spending levels on evidence-based practices funding throughout the recent fiscal years. There's a little bit of fluctuation in 2016 through 2019. This was the time period under which Maryland was operating under a Title IV-E waiver. In the most recent fiscal years, 22 and 23, the funding level's been fairly stable. The funding level in the 23 allowance and the 22 working appropriation relies almost entirely on federal funds. DLS is noting, however, that even if eligible for federal reimbursement, some of these practices still require a federal match rate of about 50%. So we're asking the department to comment on the spending plan related to that fact, as well as providing an update on the cost allocation plan that it had submitted to the U.S. Department of Health and Human Services, which is part of the necessary submittal for federal reimbursement. Once approved, that would allow for retroactive reimbursement back to October of 2019 for these services. The other large factor within the Family First Prevention Services Act is related to the designation of qualified residential treatment programs. The other main component of the federal legislation was seeking to limit reimbursement for placements in non-family placements in order to promote placing children in the least restrictive, ideally family-based settings when appropriate. And this change in statute stated that outside of a designated qualified residential treatment program, or QRTP, there would be limited cases for federal reimbursement. The Department of Human Services has indicated in its JCR response that it has worked with the Department of Juvenile Services on a designation process for QRTP in the state, and that has designated the first of these providers in January of this year. DHS is also, DLS rather, is asking DHS to comment on the status of this QRTP designation process, as well as the status of overall Family First Prevention Services Act implementation. I'm going to briefly cover the next couple issues for the interest of time. Number 3 is the moratorium on older aged foster youth aging out of care. On September 30th, rather, of 2021, the end of the federal fiscal year, the national moratorium on older foster youth aging out of care expired. During the earlier portion of the pandemic, as passed in the Consolidated Appropriations Act at the end of calendar 2020, there had been some temporary flexibilities put into place. Some of the notable ones were expanding the age eligibility for foster youth through the age of 26 in order to receive services through the Chafee program and the Educational Training and Vouchers programming funds. The other main change was removing a temporary requirements for work and education. Specifically within education, there was flexibility granted that if academic progress was not being made as a consequence of the pandemic, that would not impact the eligibility for receiving funds. So this moratorium expired on September 30th. There's been a bill introduced in Congress to temporarily extend these flexibilities. This bill has been passed in the U.S. House of Representatives. However, it is currently pending in the U.S. Senate, and the status of the future of that bill is uncertain. So the analysis is also asking the Department of Human Services to comment on the status of services that it is providing to older age foster youth in light of the federal moratorium expiration. The other item, which I'm not going to go into great detail about for the audit report, since there were already hearings that took place on this topic, but the findings, a summary of the most recent fiscal compliance audit released this summer, are included in appendix number 2 at the back of this analysis. There were 8 findings in total. The Joint Audit and Evaluation Committee held hearings on October 25th and November 9th, in which both the Office of Legislative Auditors and the department had a chance to testify on this. The analysis also notes that there's been a Senate Bill 820, which was introduced during this session based on some of the concerns raised during the hearing that would require notification of delays in completing investigations and reporting requirements for certain required functions. Consistent with recent practices in the budget bill, the Department of Legislative Services is including budget bill language which would restrict funds pending the report of the Office of Legislative Audits that action has been taken to address the findings of the audit. The final issue that's covered in the analysis is related to caseworker staffing and caseworker caseload standards. Pretty much annually, the General Assembly has asked for this data from the department and has looked at the level of caseworker staffing related to standards set by the Child Welfare League of America on ratios between staffing and caseloads. This chart, Exhibit 18, is showing that based on the current staffing data provided as of September 1st, 2021, the department is currently meeting the standards laid out by the Child Welfare League of America. There was 905 positions that would be required to meet the standard for caseworkers, and there was a total of 1,188 that were filled. DLS is commenting that despite the fact that the caseload standards are currently being met, we would like DHS to comment on the current vacancy levels within the department and specifically within the Child Welfare Services Department, any efforts currently being made to fill some of these additional vacant positions. DLS is noting that although the caseworker caseloads are being met and were also being met last year, in the case that overall caseload sizes increase as some rebounding to pre-pandemic trends occur, if caseload sizes increase, there could be challenges in the future with meeting caseload standards with high vacancy levels. Lastly, for the recommended actions, I'm going to briefly try to go through these. DLS is making a total of 8 recommendations. The first, as previously mentioned, this was the budget bill language relating to the audit finding, restricting funds until the Office of Legislative Audit submits a report. The second the second recommendation is committee narrative. This is similar to what's been requested in previous years, asking for data on youth hospital stays and overstay data. Recommendation number 3 is a similar piece of narrative as last year, requesting updated information on the implementation of Family First Prevention Services activities, and one of the main items specifically asked for is information on the QRTP designation. Recommendation number 4 actually is committee narrative asking for a status update on the implementation of the new foster care provider rate structure. This is briefly mentioned at the end of the analysis in the update section. The department is currently working on implementing a new rate structure, and this recommendation would ask for an additional status update on that later in the year. Recommendations 5 and 6 are both annual budget bill language restricting the general fund portion of the appropriation for the Foster Care Maintenance Payments Program and the Child Welfare Services Program to that purpose only. Recommendation 7 is also similar to annual narrative that is asked for the child welfare caseload standards data. And the final recommendation is new committee narrative that is asking for additional details on the removals into care that are related to economic instability caused by the pandemic, and to try to look at if some of the increased economic hardship and economic uncertainty that's been caused by the pandemic has had an impact on the rate of removals into foster care. The report is also asking for an additional discussion of the child maltreatment reporting, and if there are any impacts that the department's observing related to addressing the low reporting of child maltreatment report. But I believe that will conclude the DLS presentation. I can take any questions at this time.
Thank you very much. Are there any questions for the analyst? Okay. Looks like you've done a comprehensive job. I see no questions. So with that, we'll turn to Secretary Padilla. Good afternoon. Seems like only yesterday.
Thank you, Chairman Griffith, and members of the committee for the opportunity to discuss the FY 2023 budget allowance for the DHS Social Service Administration. I have my team here with me today, Gregory James, Deputy Secretary for Operations, Nesana Kibret, Deputy Secretary for Program, Denise Conway, Executive Director for Social Service Administration, and Stafford Chipongo, Chief Financial Officer. Also available to answer questions as necessary are Daniel Waite, Director of Human Resources Development and Training, Marva Sutherland, DHS Inspector General, Cole Hachipanos, Audit Compliance Social Service Administration. I want to take the time to thank Samuel Quist for his comprehensive and concise analysis. It's a pleasure to work with, and we appreciate all your support, Samuel. You have my written testimony, which I won't repeat here, but I will share a few quick highlights. As of December 31st, 2021, we had more than 4,300 children in out-of-home placement. The majority of the children, more than 3,000, are in family care settings. The other youth are placed in group homes, independent living, residential treatments, or other settings. Since 2015, over 11,000 children have exited foster care and safely returned home, moved to guardianship, or have been adopted. In fiscal year 2021, 794 children achieved permanency. With the pandemic improving and the courts' access increasing, the department is now able, once again, to aggressively pursue permanency for the youth in our care. We continue our implementation of Family First and our transformation of the child welfare system to focus on families. We're building a prevention-based approach that emphasizes partnering with children and families. Our transformation has three priorities: enabling families to access evidence-based practices, to keep them safely together, establish qualified residential treatment programs to provide high-quality therapeutic intervention for youth who need short-term residential care, and implementing the new assessment process to determine the appropriate level of care for children and youth who are entering care. The department also provides vital services to aging and vulnerable adults. In 2021, the Office of Adult Services conducted Adult Protective Services investigations, served as guardians for vulnerable adults, provided in-home aid services to individuals, helped 405 clients remain in their homes and avoid costly institutional placement through Project Home, and provided needed support to vulnerable adults through social services to adults case management. And finally, in 2021, we deployed the Adult Services module of CJAMS, the Child, Juvenile, and Adult Management System. The Adult Services had never had a dedicated data system. They have managed with paper files, ad hoc spreadsheets, and similar make-do solutions. With CGMs, now Adult Services caseworkers are now able to use this mobile platform, to deliver services and ensure continuity of care. And we're very, very excited to have been able to do that for them. That concludes my opening remarks. Now, with your permission, I will move directly to the recommended actions and issues in the analysis. Thank you. The DLS analysis contained 8 recommended actions. The department concurs with all the recommendations. Now, turning to the issues, in response to issue 1 regarding trends in maltreatment reports and child welfare caseloads, we're seeing a return to pre-pandemic level of reports for suspected child abuse and neglect. The trend appears to be directly related to the turn to in-person learning for school-age children. It is premature to reach conclusions on any trends, comparing this data with previous year's data. In Maryland, CPS investigations are not categorically rated by severity, so we are unable to comment on trends related to case severity. We will continue to monitor these cases. In response to issue 2, regarding the department's step to reduce the rate of victimization for youth in youth care, foster care, we're very concerned about this rate to children in foster care. DHS believes that the higher rate is driven by incidents of maltreatment which occur before, and I put emphasis to before, the youth enter in care, but are only disclosed after the youth is in care. DSS is working to better distinguish between the date of incidence versus the date of the report. 98% of children in care did not have the reoccurrence of maltreatment within 12 months of the first occurrence. DHS is committed to the safety of youth in foster care and takes measures to reduce the rate of their victimization. Communication is critical, we know that, so DHS uses a variety of channels to engage and maintain contact with youth in care, such as text messaging, because that's what they use, social media, virtual meetings, and of course, face-to-face meetings. Caseworkers are trained as coaches to partner with the youth to empower them to voice their concerns and experiences. We will continue to monitor the data to discern the cause of the increase. In response to issue 3 regarding placement stability, we're committed to making sure that our resource parents have the necessary resources to care for children and youth in our out-of-home placement and thereby reduce the risk of a placement moved. We have procured the newest version of the PRIDE resource training, parent training. We believe the PRIDE training will better equip our resources families to appropriately care for our children and youth in out-of-home placement and will also help maintain youth in the least restrictive environment. DHS staff are also being trained with additional skills and are being equipped with specialized tools towards placement stability. In response to issue 4 regarding how the department plans to distribute the $5 million provider rate supplement, the department plans to distribute this supplement as one-time only grant to all providers whose rates are set by the IRC based on the provider fiscal 2023 capacity. In response to issue 5 regarding funding for foster care payments, we concur with the analyst's recommendation to restrict the general fund appropriation for this program for that purpose. In response to issue 6 regarding the status of the approval of the cost allocation plan, DHS received feedback from the Federal Administration of Children and Families on the cost allocation plan in April 2021. DHS provided an updated cap, and we received additional questions from ACF in January 2022. DHS has responded to the January questions, and we're now awaiting the final ACF approval, hoping to get that soon. In response to issue 7 regarding state match funding for evidence-based practices, DHS will work with the Department of Budget and Management to address any state match funding needs if necessary. In response to issue 8 regarding DHS and DJS collaboration on the designation of qualified residential treatment providers, or QRTP, DHS has worked collaboratively with the Department of Juvenile Services to designate providers as QRTPs. The first applications were considered in October 2021. In the first round of review, 13 providers that applied and 6 were approved, which is good. DHS, in conjunction with DJS, is providing technical assistance to the 7 other providers so that they can also be approved. In addition, training for qualified individuals to perform the required youth needs assessment for placements in a QRTP is scheduled for March 2022. Full implementation of QRTPs is scheduled for June 1st, 2022. In response to issue 9 regarding the efforts taken to support older foster youth following the expiration of the national moratorium on youth aging out of care, DHS is committed to supporting older foster youth beyond the expiration of the national moratorium and has a comprehensive aftercare approach that supports all young people in their lifelong success. DHS staff are supporting youth with voicing their priorities, fostering permanent families as identified and defined by the young people, assisting with their building connections, and improving their overall well-being. We have launched the My Life website, which provides youth with improved access to information and resources. In response to issue 10, DHS concurs with the analyst's recommendation to restrict the funding in SSA pending an OLA report on our corrective actions to address repeat audit findings. In response to issue 11, efforts to fill vacant caseworkers and supervisory positions, the department consistently works with the local departments of social services to streamline recruiting and retention of child welfare caseworkers and supervisory staff. As part of that effort, the department has established a vacate and fill policy for caseworkers positions, which gives local departments the ability to begin recruitment as soon as a current employee provides notice that they are leaving. The caseworker and social worker positions are posted on an open and continuous basis, allowing the department to hire as needed. Finally, with regards to the department's response to the Office of Legislative Audits 2021 audit report for the Social Service Administration, DHS is committed to addressing and resolving all findings identified in the OLA audit. As I share in the overview testimony, we have established a new dedicated audit compliance and quality improvement unit in SSA to focus on these audit issues. We're also receiving support and technical assistance from the DBM Audit Compliance Unit. The department's initial responses to these findings were included in the issue report, and we have provided updates on our subsequent corrective actions in our written testimony. I understand the auditors have conducted their preliminary follow-up assessment, and from what I'm hearing, we have made good progress. This is my last budget hearing in front of this committee. So I would like to take the opportunity to thank you all for all your support to me and to DHS. This concludes my testimony and response, and I will be happy to address any questions the committee may have. Thank you so much.
Thank you, Madam Secretary. I was a little stunned by your last comment. I was like, last budget testimony ever, or you mean for the 2022?
Well, the administration is in the last term, right? And we all know what that means, so.
Oh, I don't go predicting the future, but your point is taken. Good. We
Yeah.
appreciate your testimony, your responses to DLS's recommendations and issues, and members, that testimony, as you know, is available online and paper copies on your desk. Senator Eckert has a question.
Thank you very much. Actually, I have two issues. And the first one is just a thank you the write-up about Family First is really tremendous. Thank you for doing that. I had been working with them on the Family First out of an NCSL, I think it was called. And so this is really helpful. As you know, Maryland was really way out in front of this, I guess, gate in well before other states had gotten together to be able to, we already had our plan in place, and it was just a matter of getting that plan out, and as I understand it, getting it supported by everybody in the community. And as I look at all of the different evidence-based practices that are starting up and implemented, this is very impressive. So I just wanted to say thank you very much for that. But I did have a further question. In looking at the number of days that our youngsters stay in the hospitals, either medical or psychiatric, and I know you've put together a work group and we're working through the Children's Cabinet to get some specialized planning. Did you all come to any conclusions, or is there a report available going forward, since there is going to be a change in 9 months, so that there is kind of a template or in place for where we need to be going in the future?
We have the Children's Cabinet, Governor's Office of Crime Prevention, Youth and Victim Services, right? We have been working collaboratively, MDH, DJS, MSDE, DHS, a group of us are working on identifying what's the need, the capacity needs that we must have, and the specialized care that we also need to address the hospital overstay. And in doing so, a plan was outlined that I can share with you if you would like me to. And in that process is that based on that plan is that we have been focusing on what next steps we need to take to improve in that area. I'm going to stop talking here, and I'm going to let my Executive Director for Social Service Administration to expand on my response as well, if you would, Denise.
Yes, thank you, Secretary, and thank you for the question, Senator. We are very much focused on youth that are remaining in the hospital and how we can partner with our local hospitals and our provider community to ensure that youth are put in environments that meet their individual needs. And as the Secretary mentioned, we are focused on resolving this matter in collaboration with providers across the state of Maryland, and hope to resolve this in a way that meets everyone's needs.
Thank you very much. I just can't stress how important it is. It just seems that we are getting more and more youngsters who have very critical specialized needs, specialized pediatric care. And I know I will get calls every once in a while about families who just do not have the funds, and we don't have the resources on the Eastern Shore. And so it becomes a real hardship for families to access services because they have to go to the more metropolitan areas, and that gets to be an issue. So I know we have our child care consortium in Upper Shore and Lower Shore, and they try to fill that gap. But as you know, Madam Chair, this is such critical need. Just finding a child psychiatrist, it's just amazing. And we met with some of our hospitals this week, and they expressed the same thing. Where do we need to go to get the kind of resources to be able to meet the needs of our families? And so often our lower income families are the ones that bear the brunt, need the most help. So anything we can do to move that forward is certainly really important, wouldn't you say?
Absolutely, absolutely, and thank you, Senator, for bringing that. And as always, we will continue the good partnership that we have had. This is not only departments that, but as Ms. Conway say, we have community partners out there that we have also engaged in the discussion. And the one thing that you brought up that is very interesting, and I want to call to this committee attention, that many times, while it's bulk as children in our care, sometimes they're still not in our care. They're still with the parents. They're placed in the hospital, and we are, of course, the last resource. So the child might end up being in our care, but by that time they could have been in the hospital for some time. So it's more communication that we are engaging with the hospitals as well, so we can get early notification and whatever steps are needed to be taken, that we can be, as I share, in the prevention mode, and start planning what the next step for that child is sooner than later. And I'm very excited to, on the Family First, as the senator said, that we are focusing on prevention more than after the fact. And it would be that model, that approach, that would allow us to focus on the many needs that the children have in Maryland and in early stages. And this is going to be not only the Department of Human Services, as you saw, the Department of Juvenile Services is also involved. And, I'm looking forward to including other partners within the state and the community partners, so we can be more successful with Family First.
And if you don't mind, I just have one more question. A situation came to me recently where a family said that in order to qualify for services for their child, they had to relinquish custody of their child, so the child became a, quote, ward of the state in order to get services. Is that so?
That's why Family First is so important, because that's the old traditional way in order for them to be able to have services. That was the case. Now, Family First is looking at changing all of that, and that's why I
Okay.
said that preventive model approach is so important.
So you were transitioning, so maybe these were some of the families that haven't, Family First hasn't gotten to. And is there any way we can expedite helping that roll out, I guess, is what I'm asking.
Yeah, and before I do that, I would like my director for executive, the Secretary Director for Social Services to speak a few words on voluntary placement services to address some of what you just said, even before Family First. If you would speak to BPA, please.
Yes, Secretary. So our voluntary placement agreement is just that. It's an agreement between the family and the department, but we do consider that a last resort, and that is so that children can enter into residential treatment centers to get their mental health needs met. The parent is very much still involved in that process, and the child is not a ward of the state. We are assisting with placement services.
Okay, thank you. Because it sounded a little more restrictive with the situation I've been involved in, so I'll get that clarified. Thank you.
As always, Senator, and we're always available to you and any other member to the committee whenever you need us to come in and visit you, right? and talk a little bit more and have discussions. I know this is something you're very passionate about,
Right.
so more than welcome.
Thank you. Thank you, Madam Chair.
Thank you, Senator. Thank you very much for your responses. I don't see any other questions from the subcommittee. I will just say two words, just because I would be remiss if I didn't, and certainly that is that one word is vacancies and focus on recruitment and retention, and the second word is, and it looks like you're already working aggressively to address the audit findings, and so appreciate the feedback on that. Thank you all very much for your testimony, and Madam Secretary, I suspect I'll see you again at least before we adjourn, so.
Thank you so much.
Thank you very much. Colleagues, we do have some testimony on our desks and have some witnesses who have signed up. And I'll just call them in the order. I have them on the sheet in front of me. I have Keith Booth and Denise Gilmore. I see Denise, welcome back. Just when you thought you were out, we pulled you back in.
Good afternoon and happy Friday, everyone.
Yes.
Unfortunately, Mr. Booth just had to take off. He had a medical appointment at 3 o'clock, so he had to take off. But for the record, my name is Denise Gilmore. I'm a field director with AFSCME Council 3. We represent the hardworking men and women who work for the Social Services Administration. While the delay unfortunately caused Mr. Booth not to be able to testify, it did give me a chance to spend quite a bit of time with him, actually, in the hallway, and truly remarkable guy. And, with your permission, I'd certainly love to share a little bit of what he would have, testified on today if he would have had the chance to stay. But before I do that, on behalf of Council 3, I know we were very interested in working with this committee and the department on figuring out a more accurate assessment for the caseload and staffing ratios that are in the city. Just as a quick example, I know on, in the analysis, there's reference to, DHS meeting the caseload standards for the Child Welfare League of America, and it indicated that Baltimore City, for instance, had a surplus of about 90 caseworkers. And that happens year after year. It just always feels like there's a very large gap between what's reported in terms of staffing ratios and what the lived experiences of our members. So I'll, jump into Mr. Booth's story then. He is a social worker for the Baltimore City Department of Social Services. He's been a social worker for over 20 years. He has experience working in child welfare in Washington, D.C. He has experience working in adult protective services. He's worked in a lot of different settings, and, when he got to Baltimore City, I think, a few things really stood out to him. One is that the caseloads are very high. He's currently carrying a caseload of 22. That's almost double, actually, what the Child Welfare League of America recommends. He wanted to emphasize that that's not just, 20 cases. That means he has 20 families, and, there can be multiple children without those, within those families that he's also, charged with ensuring, safety for. So, I think he speaks up for many of his coworkers in that he's feeling very overwhelmed right now. Baltimore City, again, allegedly has this surplus of 90 caseworkers, but they're so severely short-staffed right now that they have actually asked Child Protective Service workers from 4 surrounding jurisdictions to come into the city and help with the demand there. That obviously, takes workers from one jurisdiction and puts them in another, which we're concerned about, but it also, suggests to us that there's, an issue with caseloads in the city. I will keep it, not much more in addition to that, but we do want to say that, we do think that figuring out a better kind of caseload and staffing model is important, and getting a better assessment of the accurate, workload is important, but we've also got to do much more to retain workers. From his experience, the reason that, cases are so high is just there's tremendous turnover right now. And anytime, a worker leaves, those cases then get absorbed. Oftentimes, unfortunately, with no transition, he said that he feels like his professional and ethical obligation positions sometimes are at risk just because there's no transition, right? That happens when he gets these cases on him. And it's just, I know this is a, situation I'm sure no one in this room wants, but I think, we can certainly do more and hopefully, this is, something that we can be committed to working on, leaving this hearing too. It's certainly with the, state's financial picture currently, we want to see a bigger investment in our child welfare services across the state. So thank you very much. Appreciate the opportunity to testify.
Thank you. Are there any questions from the subcommittee members? Okay, seeing none, thank you so much for sharing your testimony and for representing Mr. Booth's testimony. Appreciate it. All right, we're going to turn to Therese Hessler. Okay, that might just be written, yes, and it looks like the other person I had was just written as well. Catholic Charities, right? So I see no other witnesses signed up to provide oral testimony. Seeing no further comments from the subcommittee, thank you all very much. Please have a safe and enjoyable weekend. Meeting adjourned.